badly all the companies that you work with feel that they've been hit because of the second wave of the COVID pandemic, Uday?
When you talk about the economy, I think there's one big difference. Last time there was a national lockdown, and this time the lockdowns were at state levels and in some cases more localized. So as a result of that, the supply side of the economy was less disrupted. However, there was a lot of disruption because it wasn't that the supply lines and the manufacturing etc. was going on unaffected, because so many people were affected, so many people were testing positive, and the atmosphere of fear was so high that people were really worried. So things came to a halt. Retailing almost entirely came to a halt. So when you're producing or manufacturing and you're not able to sell or distribute, then it does create its own problem, and the end result is pretty much the same.
If you would recall, rural was very resilient last time, and COVID had not impacted rural India at all. This time that has impacted, and we could also sense it, that when it comes to the last mile distribution, the wholesale mandis, many of them came to a halt. One was the restriction, the second was many of the people fell ill, the traders fell ill. So that was the kind of impact we felt this time.
We've been working very closely with the center and the state governments, and this year they worked hard to ensure that there wasn't an impact on frontline workers, on migrant laborers, and therefore production still continued, not at 100%, but in most cases at a reasonable pace. Demand was slower, but on balance, we will not see a great drop in GDP as we saw in the first quarter last year of 24%.
See, if you see last year, the health impact was lower because we locked down very early. It was a hard lockdown, but the economic impact was very severe because it was a complete lockdown. If you see the wave 2, I think the health impact is much higher, as we have seen hospitals have been overwhelmed and all, but the economic impact has been lower because it's not a complete standstill. So part of what we are seeing from investors' point of view, they are looking across the curve. They are saying the economic impact will not be as much.
Opposition ruled states like yours seem to suggest that it is the centre's responsibility for procurement and payment of all vaccines. Let's get clarity. What is the basic reasoning that you and others now have for this? Your position?
So the centre has this strategy of playing it both ways. When it suits them, they say, we'll take care of it. When it doesn't suit them, they say, no, you take care of it. For example, on the purchase of drugs like remdesivir, we had open contracts with the central government to cover the purchase orders, saying that we will acquire all the drugs and allocate them proportionally because there is a constraint in manufacturers. So this brings up the question, is it an open market, a free market or not? An efficient market will have many buyers, many sellers, and the ability to get a fair price based on supply and demand. That's the indication or the validity of an efficient market.
Vaccine now must be procured centrally by the Modi government and made available free for all, no differential pricing, as the Supreme Court said yesterday.
Government of India has stepped in to support all the states, and that is precisely why Government of India initially they bought the vaccines, they distributed to the states 45 plus, and till now I think we have vaccinated more than 22 crore people in India, and we were the country to reach 20 crore I think the fastest way. We all know that we need to share our responsibility. Health has always been a state issue, but however, because of this unprecedented pandemic times, Government of India has stepped in and it used to procure for everybody. But that is when the politically motivated people, the parties, some sections of the media, they said, why centralized procurement by the center? Why everything from the central policy? It has to be decentralized. Let every state buy. These were the things that went on a few weeks back. And when they decentralized, we are seeing that states are fighting with each other, going for global participation of tenders, and this is what is happening today.
India, perhaps proven right, taken the right steps, saying no to the Chinese vaccine. its efficacy is in question, and the country refuses to share information, not just about trials, but also side effects of the Chinese vaccine, sir.
Even the head of China's CDC publicly admitted that efficacy of Chinese vaccines is low. He called for improved vaccines to be developed. So when the head of China's CDC says that openly, it's such an admission that the Chinese vaccines are not effective. But China is using vaccine diplomacy in a major way to help repair the damage to its image and reputation. The pandemic has driven negative views of China to a record high internationally, according to a survey done by the Pew Research Center.
It is well known, of course, that the Pfizer vaccine has much higher effectiveness as well as efficacy as compared to the Chinese vaccine. Chinese vaccines, as we know, there's been a wide range of claims starting from 50.3% and going up to nearly 90% in different small trials that were done in Indonesia, done in Brazil and elsewhere. And a recent, paper in the JAMA, which is the first time that actually we got some peer-reviewed data, it says it varies between 72 to 78.
Okay.
How true that is, time will tell. But the fact is that the Pfizer vaccine is definitely better with an efficacy of 95%.